We tried several diets and we'd lose some and then gain more back.
We tried very hard to be as active as we could.
It was just an endless cycle that we just couldn't get out of.
That is pretty typical pattern you see. Sometimes we call that the yo-yo diet, where we're typically kind of just bouncing up and down.
I even did the cabbage soup diet. We did the slim fast. We had minor successes, maybe 15, 20 pounds, which is a good weight loss, but 6 months later I gained most of it or all of it back, plus some usually.
Patients do lose weight, but it's not enough to reduce their diabetes, reverse their high cholesterol, prevent them from having diabetic-related complications. And more importantly, they frequently put on the weight and sometimes more. So if someone is in the category of morbid obesity, they're not going to be successful enough with diet and exercise.
The word morbid obesity basically means that you're overweight, that it affects your overall health. Typically when we consider morbid obesity, one way to think of it is about 100 pounds overweight. But really we classify that according to the body mass index, or the BMI, which is just a calculation based on your height and weight. To be morbidly obese, typically you consider a BMI of over 40, or sometimes over 35 if you have other health conditions as well.
I had a friend who actually was considering bariatric surgery, and that's when I started realizing what the BMI was and where I fell in that category, and that's when I really realized, wow, this isn't good, this is where I am.
I had high blood pressure, I had high cholesterol, I was borderline diabetic, I had severe sleep apnea. It was pretty severe. My doctor said if I had gone much worse, he would have put a trach in me.
If a patient can lose weight and reduce their health risks with diet and exercise, that would be ideal in terms of not having to undergo surgery. Frequently, after they've tried that for a number of months, they have not lost enough weight to reverse their health-related risks associated with their morbid obesity. So those would be people that we sit down and talk with in more detail about their options in terms of surgery to reduce their weight and reverse those health problems.